Right, so today is Thursday, the 6th of August. My name is Dr. Evert Berger, and I've started this new channel called The Daily Dentist. And the idea would be just to upload cases we do or things we do in our dental practice here in Dorp Street, Stellenbosch, on a daily basis. Just to show you guys what we're up to and what we do, because I really think we do amazing things, and we change people's lives on a daily basis, and I think that people don't realize what a big impact a dentist can actually have on someone. And it's also just fun to show you guys what kind of toys we play with and what kind of instruments we use and what kind of technology we use. So I'm going to try and post on a daily basis. You can expect it not to be fancy, and it's going to be a little bit off the cuff. So on the first episode, or on the first show, I want to just tell you guys who I am and what my treatment philosophy is and why we do things the way we do it. And I'll show you one case as an example, because I think it's also a very good case. So I'm a dentist. I'm a normal dentist. I'm not an aesthetic dentist or any specialist dentist. I think the important thing for me is that dentistry is kind of moved away from being so-called doctors that we're supposed to be, and we've moved into being aesthetic practitioners, and it's more important for us to make you look beautiful and to keep you healthy. So my goal and my philosophy in dentistry is not to be an aesthetic dentist or cosmetic dentist or whatever they call it, but my goal is just to keep your teeth in your mouth for the rest of your life and make sure you, one day when you hopefully die very old, that you've got all your teeth in your mouth and that your teeth are healthy. And I think that's the basic of good dentistry, is making sure people have teeth. First of all, their teeth are completely healthy, they're completely functioning, they can breathe properly, and that they are just good working order. And I think too many of us has moved away from that philosophy, and we've moved into this aesthetic thing. So in this case I want to show you today, I want to just tell you what I do and what my philosophy is. In 2019, Ricardo Matrani, who's a Mexican prosthodontist, I think he wrote this, The Less is More approach, in the Spear magazine for dentists. And this kind of resonated a lot with me. It's called The Less is More approach. And I kind of now use this on a daily basis on treatment planning. Whenever I do any treatment for anyone, I use these 5 elements that he describes in this paper on how to approach this case. So you can see the first one there is maintain the most tooth structure. That just means don't cut away unnecessary healthy teeth if you don't need to. Second one is minimize the amount of teeth involved. Very often just 1 or 2 teeth bothers a person on an aesthetic thing. You don't have to go redo the mouth and the upper and the lower teeth just because 1 or 2 things are bothering. I think a lot of times we've moved away from what patients actually want or what bothers them, and we just want to put in what makes the most money or what amazing technology we've got that we can use. So I always try and minimize the amount of teeth we get involved with. Utilize the least invasive techniques. An example of that is, instead of doing a bridge, which is a very old technique, you would do an implant. Or when you do the implant, you plan it properly by using a guided implant system, so you don't have to open up the patient so much or spend more time. So I think we using in Dorp Street Dental, we use a lot of technology, and that's another thing I want to show you guys on a daily basis on what we use and why we use it. And that just makes treatment much easier, much more comfortable. The other one is delayed treatment. We often kind of sell dentistry to patients and tell them that this is going to last forever. If I replace your tooth with an implant, you're going to die with that implant in your mouth. And that's not necessarily the truth. Everything's got a shelf life. Nothing lasts forever, and dentistry is the same thing. So we've got to delay treatment to make sure that we get the treatment that's going to last or outlast the patient and is not going to fail, or not give the treatment that's going to make the most money or be the most amazing result at the end. So delaying treatment is a very important thing. And then the last one is phasing treatment, which means we don't have to go into an immediate set of veneers or crowns or whatever. We can delay that treatment. And we need to, I think our responsibility is to explain to the patient that, listen, this is going to last 15 years. Maybe let's try something less invasive for now, and then we can step you up to the next thing. So that's just my approach to dentistry. Like, I kind of always want to keep those things in mind when I do any treatment planning for a patient. So I want to show you guys a case that is actually a good friend of mine, and she presented to the dentist with those two little teeth. You can see there, that's funny, two little cute teeth. And that was the main complaint. They were uneven, they were slightly shorter, so that kind of bothered her. And then the dentist proceeded and gave her a very well-planned full treatment on basically crowns on all the teeth. Now, she didn't need crowns on all the teeth, and she didn't want crowns on all the teeth, but that was what was presented and sold to her. And you can see the planning, which was very well done and meticulously done. But keeping the 5 elements in mind that Mitrani wrote about, none of that is being applied in this case. I mean, maintaining tooth structure, no tooth structure is being maintained, because if you want to get a result like that, that's basically 10 crowns you have to cut. So you basically cut away 80% of your very healthy enamel away to put a fake thing on that's not going to last forever. So I don't know whether we think sometimes that we're going to give you a better result. We're not. If you've got a healthy tooth, you want to keep that tooth as healthy as possible. You don't want to cut away unnecessary tooth structure. So doing crowns on a healthy young person with good oral hygiene, I just don't understand it at all. It's not minimizing the amount of teeth involved. Only 2 teeth bothered her. We don't have to go drill 10 crowns. Utilize the least invasive techniques. It's not delaying treatment, and it's not phasing treatment. So when I see cases like this, I sometimes just wonder, why did we move away so far from what we're actually supposed to do, and that is keeping people healthy. It's not really supposed to making as much money as possible or putting as much porcelain in someone's mouth as possible. So anyway, so she actually accepted this treatment plan. She was on her way to do it, and then she phoned me and she said she felt a bit uncomfortable. She's a very good friend of mine living abroad. I asked her then to send me all the things, and like I said, I just don't understand why we want to be so invasive. So what we did for instead, we started with aligners. Aligners are modern braces, basically, that's clear and it's not very, very visible. So we put her through, I think, 10 or 15 sets of aligners, which just aligned all the teeth. So we didn't cut away anything, we just aligned everything and we got them in space. Also, she, like I said, she lives abroad and we had to send the stuff there, and we successfully could get the alignment done to a place where we were happy. We also used the Waterlase, which is our big laser that we just trim the gum slightly just to get the tooth proportions right and to get her teeth to look like they fit around the gum. And then the last thing we did, we just used a bit of composite, which is just white filling. We just stuck it on the teeth just to level out the teeth at the bottom and redo some of those fillings. And I'll show you the results we got. So you can see there's the before and there's the after. I'm sorry for this blurred picture, but I never took any before pictures because she was living abroad, like I said, but this was just a zoomed in picture of the upper one. But you can see the malalignment of the teeth, which we aligned with the clear aligners. We trimmed the gum there. You can see a little bit of black still sticking out, but just to get the length of the teeth a little bit better. We could have probably whitened first, she wasn't here long enough, and then we just used the composite to build up the teeth. Now she's super happy with this result. It costs a fraction of the cost of what it would have cost to rip up all the teeth and do crowns and veneers. And she's still got her own healthy teeth that she's still going to keep in her mouth for the rest of her life. And there's way less things that can go wrong with this treatment. Probably the worst case scenario is you can chip one of those composite fillings within the front, but it's super easy to fix. There's no margins that she needs to keep clean. It's just a way better result going long term than having a set of foreign veneers in your mouth. So going through and doing all these daily cases, I'd like to show people and dentists that we don't have to go and be aggressive. We can be minimally invasive. We can still get amazing results. And we don't have to try and find the most perfect result for the person. We can just sometimes just keep them healthy, make sure they are in good function, make sure they're breathing properly, and make sure that they are happy with the aesthetic result. We don't have to force a result onto people. We can just give them very basic dentistry that doesn't cost a fortune and that doesn't damage their teeth. So I hope you enjoyed this first case that I posted. I'll be posting a lot more of these cases. And if there's any questions or any comments, you're welcome to look at the link in the bio and send us a WhatsApp or send us an email. Or if you're a dentist and you don't agree with what I said, please also comment or leave a message. I'm looking forward to see you tomorrow, and we'll post another case. Thank you very much.